Recovery after surgery often feels very different from what people expect, and that difference alone can create a lot of unnecessary worry. Most people imagine recovery as a steady upward slope. They expect the hardest part to happen early, followed by gradual, predictable improvement. Each day should feel a little better than the one before, and each week should clearly improve on the last. When that does not happen, concern often sets in. Recovery can begin to feel confusing, frustrating, or discouraging, even when healing is actually progressing normally. Understanding why recovery often feels worse before it feels better can make this phase easier to interpret and much less alarming. Early in recovery, the body is focused almost entirely on protection. Inflammation is active, tissues are sensitive, and the nervous system is alert and reactive. This is not a failure of healing. It is the body doing exactly what it is designed to do after a significant stress. During this phase, the body prioritizes stability over comfort and safety over performance. Pain, swelling, stiffness, and fatigue are common. Even small movements can feel demanding. Energy may feel limited, and rest may not feel as restorative as expected. This does not mean something is wrong. It means healing is active. As the earliest phase passes, many people expect relief to arrive quickly. They assume that once the first few days are over, symptoms should steadily decrease and recovery should feel easier. Instead, they may notice soreness becoming more noticeable, stiffness increasing, or fatigue lingering longer than they anticipated. This can feel like a setback. In most cases, it is not. What is happening is a transition. The body is slowly moving from protection toward re-engagement. As activity increases, healing tissues are exposed to new demands. Those demands create feedback, and that feedback is often experienced as discomfort. This is one of the main reasons recovery can feel worse before it feels better. In the earliest days, activity is limited. Movements are cautious and brief, and rest is frequent. As recovery continues, daily life begins to return in small ways. You may sit longer, stand more, walk farther, or begin handling responsibilities again. Each of these changes places additional stress on healing tissues. That stress does not mean damage has occurred. It means adaptation is underway. The body responds by reminding you that it is still healing. That reminder often comes in the form of soreness, stiffness, swelling, or fatigue. These signals are easy to misinterpret, especially if you expected recovery to feel smoother by this point. Fatigue plays a particularly important role in this experience. Many people underestimate how long fatigue lasts after surgery. Even when pain feels manageable, energy may remain low. Ordinary tasks can feel disproportionately difficult, and that can be frustrating. Fatigue is not just physical. The nervous system has been under strain. Healing requires energy, coordination, and attention. When fatigue shows up, it can make recovery feel heavier and slower than expected, even if progress is occurring beneath the surface. Emotionally, this phase can be challenging as well. Early on, there is often relief that surgery is over. As days pass, that relief can fade and be replaced by impatience or doubt. Progress feels slow, motivation fluctuates, and it is common to wonder whether recovery should feel easier by now. These thoughts are normal. Recovery often feels worse before it feels better because expectations rise faster than healing. As pain becomes less intense, awareness increases. You notice stiffness more clearly. You notice swelling more easily. You notice limitations that were previously masked by pain medication, rest, or distraction. This heightened awareness can amplify discomfort, and it can also amplify concern. The mind looks for patterns and explanations. When improvement is not obvious, worry can fill the space. Another reason recovery can feel worse is variability. Healing does not move forward in a straight line. There are days when progress feels clear, followed by days when nothing seems to improve. There may even be days that feel worse than the day before. This variability can be unsettling. It can feel like progress is fragile or easily lost. In reality, variability is a normal feature of healing. The body responds to activity, rest, sleep, stress, and time. Those factors change from day to day, and symptoms change with them. Recovery can also feel more difficult when comparison enters the picture. People often compare their experience to others, whether that comes from conversations, stories they have heard, or things they read online. This comparison rarely provides useful context. Recovery timelines vary widely, even between people who have undergone similar procedures. Comparing yourself to someone else often increases anxiety without improving understanding. As recovery continues, many people reach a turning point, not because discomfort disappears, but because it becomes more manageable. Symptoms may still be present, but they carry less emotional weight. Confidence begins to return, and movement starts to feel more natural. At this point, it becomes easier to see that earlier discomfort was part of the process rather than a sign of failure. It is important to understand that recovery is not only about reducing symptoms, it is about rebuilding tolerance. Tolerance for movement, tolerance for activity, and tolerance for normal life. That rebuilding takes time, and it often involves temporary discomfort along the way. That discomfort is not a setback, it is feedback. Recovery often feels worse before it feels better because healing happens beneath the surface before it becomes obvious on the outside. Tissues strengthen before movement feels easy. Systems adapt before energy returns. The body prepares quietly, then gradually reveals improvement. If recovery feels difficult, that does not mean it is failing. It means it is active. What matters most is the overall direction. If symptoms fluctuate but gradually become easier to manage, that is progress. If function slowly improves over time, that is progress. If setbacks are temporary and resolve with rest, that is normal. Understanding this pattern can reduce anxiety and help you interpret recovery more accurately. The goal is not to eliminate discomfort immediately. The goal is to move through recovery with clarity. When you understand why recovery often feels worse before it feels better, the experience becomes easier to navigate. Not because it is effortless, but because it makes sense.